Good morning, everyone. This is Peter Clark at Theradex, and we are about to go through the training for the ETCTN specimen tracking with a two-step registration. The focus of this training is Protocol 10191, but this training will also be useful for any other future ETCTN protocols that will utilize the two-step registration process. The specimen tracking system is consistent from one protocol to the next. Of course, there are special customizations that a protocol might require, and I'll point those out as we go along. I'm going to begin this morning showing a few slides of the process, and then we'll get right into the environment to see exactly how the data entry is done. So first of all, we will be utilizing the open registration system for entering patient data. And this is a standard for all ETCTN protocols. And for a multi-step registration process, the site would go in and enter the first step data, which includes demographics and some other attributes of the patient as they are attempting to enter the study. Behind the scenes, there's a lot of data transfer going on, and I just wanted you to see what's happening in the background, but the site is only concerned with entering data for the first step into open. The data flows over to IWRS, which is a Theradex-based system, and it generates IDs. Those IDs, in this case, there's a treatment study ID and there's a universal patient ID. Those are both important for the specimen tracking system. They get sent back to open along with a treatment assignment code of not registered. So we're just at the first step. So the patient hasn't been determined as eligible. IWRS is then going to send all of that registration data from the first step over into metadata rave, along with the IDs that have been generated and that same treatment assignment code of not registered. And then the site will utilize metadata rave to enter some initial data, including the first specimen or specimens that are required to determine eligibility. And we'll be going through that process of how to enter that data as soon as we finish with a few of these slides. So at this point, the patient is not registered, is not an eligible patient. We don't know if they're going to be, but nonetheless, data is being entered in rave for that patient. When the specimen analysis has been done and the results come back, then the site needs to go on to the second step. The second step for the registration is, again, back in open. The site's going to continue entering the eligibility data for that patient, including the specimen analysis results. There'll be some question that asks explicitly about that specimen. And as soon as the site gives the go-ahead in open that they've entered all of the data needed, then there's, again, communication with IWRS. IWRS is going to validate the eligibility and assign a treatment assignment code for the patient. Now, that could be the actual TAC for treatment for that patient, or it might be that the patient is not eligible, and so it's a screen failure treatment assignment code. These treatment assignment codes are sent by IWRS both to open and to rave, And RAVE, of course, receives additional patient data that was entered during that second step of the registration process. Patients that are not eligible, that are screen failures, will still be in RAVE, and there's a certain expectation of additional data entry that needs to be done in RAVE for screen fail patients. On this next slide, I'm not going to read through all of these first bullet points. These are simply a summary of everything that I've talked about with regard to those graphic images. But what I want to focus on is this last bullet point, that for screen failures, the expectation is that histology and disease form will be completed, all of the forms in the baseline folder, any lab forms connected to eligibility determination, and then the off-treatment, off-study form. So that closes out that screen-failed patient. This slide deck I will send to everybody on the call for reference. The rest of the slide deck includes a step-by-step rundown of the specimen tracking process that we're now going to go through. So I'm not going to go through the slides with all of the different text on it, but it will be a reference document for you. So now we're going to look in the RAVE environment. So our protocol today is 10191. We're going to be doing this demo training in the UAT environment. Of course, you'll be utilizing the production environment and all of the different sites involved in the study. When I go into RAVE EDC for the UAT environment, I get this drop-down of selecting a role. And I have lots of different roles in RAVE. Most every user will only have one role. Anybody who has the clinical research associate role that's granted through RSS will be able to do data entry in the RAVE environment. The PI would either have the study chair role or site investigator, depending on which site we're talking about. And those who are trained in the specimen tracking would have this CRA specimen tracking role. The difference between the regular clinical research associate role and the CRA specimen tracking role has to do with the ability to enter data in the specimen forms. The CRA, regular clinical research associate role, can see all of the forms and the data that's in them, but can't do data entry. So it's really important at this point to use the CRA specimen tracking role. This role is, includes all of the privileges that the clinical research associate role has. So a user who's been through this training and has been granted this special role can do all of their data entry utilizing CRA specimen tracking. You'll notice also the biorepository role here. That would be for any institution that is serving as the biorepository. In this case, for this protocol, we're using the ETCTN official biorepository located at Nationwide Children's Hospital in Ohio. So they're going to be receiving specimens, but there are also other labs involved in this protocol and in many protocols. And anybody at those reference labs, like the molecular characterization lab in Frederick, would also have the biorepository role. And as a biorepository user, you can only see certain data, only the specimen data and any supporting clinical data that is needed in order to do analysis. Today we're focused on using the CRA specimen tracking role, but I might refer back to biorepository occasionally. So in the UAT environment, we've got Dana-Farber as the test site, and there's a whole lot of testing that's gone on here. You can see many test patients. At the bottom here, you'll notice 2 reports that are available right in the EDC environment. These are critical reports for specimen tracking, and we'll be looking at both of them a little bit later. So I've got 3 test patients that we're going to, at least we'll use 2 of them, maybe the 3rd as well. These patients, patient 46, 47, and 48, were just entered in open yesterday. We're not going to spend time right now looking at the open environment, but from the slide deck that I showed you first, if you recall, there's the first step of the registration process. And the first step leads to a patient coming into RAVE, and patient 48 we'll consider that to be that first step patient. So this patient, patient 48, is not registered yet. We don't know if they're going to be eligible for the protocol. So after the completion of the first step in open, the site would come into RAVE, into their particular site's access area for the protocol, and they would go in to work on that patient's data entry. So at this point, the specimen has not been collected. We don't know if the patient's eligible. We've got to determine that. The first step is to go to the enrollment folder. And in this folder, we see the enrollment form. See if we can move this participant list off here. The enrollment form has got demographic data for the patient. And if we look at the very bottom here, we see that the treatment assignment code is not registered. This patient is not yet in the study. In the administrative enrollment form, we see that there's a universal patient ID. That was one of the IDs that came from IWRS, went back to open and into RAVE, and also we can see the treatment patient ID. Here it's listed as the subject in the RAVE environment, MA036-0048. Both of these IDs are very important for specimen tracking. The biorepository requires there to always be 2 unique IDs. The universal patient ID is going to be the same for the same person no matter what study they're in. So this person might, through the course of their cancer treatment, might enroll in 2 different ETCTN protocols. In each case, they're likely to have very different treatment patient IDs. This person happened to be the 48th person who was registered in the UAT environment. So this subject number, the treatment patient ID, can change from one protocol to the next for the same person, but the universal patient ID will always remain the same. The first step that is required is for the histology and disease form to be completed. So in this form, which does not get completed during the open registration process, we're going to enter the stage of the disease, the tumor grade, and I'm just going to select some of the first options on the drop-down. It doesn't maybe fit exactly with your expectations of who would be in the study. And I'm going to put in, notice in this SNOMED disease term code field, I started typing lymph, and I didn't quite get to the full lymph here. And it's showing me a selected list of diseases that have the word or the characters lymph in it. So there's, I believe, 1,083 different terms in this SNOMED drop-down list. Each one of them is connected to the search field at the top. I can type in a word, or if I happen to know the SNOMED code, I can begin typing that in as well, and it will show me terms within this search list that match. So we'll just pick one of these. And again, this may not be relevant in the design of your protocol. I'm just using this as test data. So in the histology and cytopathology field, I'm going to have some data that's related to the histology of the patient. The date of diagnosis, suppose it was the 23rd of August. And the confirmation happened on the 31st. Now, we've got various reports that can be uploaded. We're asking that you don't upload the reports right away, because most of these reports, the pathology report, we have the options of surgical and radiology. There will also be the option to upload some molecular results reports here as well in the production environment. Most of these reports that come from labs might have some protected health information for the patient on them. And I've got some sample reports here. So here is the pathology report, and it's got the patient name right on it. We cannot have the patient name, their medical records number from the hospital. We can't have their social security number, even their phone number. It's perfectly fine for their date of birth and for their gender and their physician and all of the other data relevant to the pathology report. The protected health information data that I mentioned first needs to be redacted from the report. So we have a procedure we'd like you to follow for doing that redaction. You could choose to simply cross this information off, but we have some IDs that we would like to be associated with this pathology report, that universal patient ID and the treatment patient ID. So we're going to continue with our data entry and come back to upload reports in a little bit. So I'm going to save the form as it is now. There is randomization in this protocol, and IWRS is also the application that handles that. So you can inspect the stratification factors for the randomization in this form. That's not critical for the specimen tracking, so we're not going to look at it right now in this call. Going back to the patient level, you can see there's an all specimens folder, and it's got some data in it already. That was a derivation coming from the enrollment, coming specifically from that histology and disease form. Before we look at this all specimens folder, I want to point out that we've got a baseline folder that has prior treatment forms and also baseline medical history, any baseline symptoms. So all of these are important for the specimen analysis and should be completed, even for a patient that you're not sure if they're eligible. This is part of the determination of their eligibility. I'm not going to complete these forms as part of the training right now, but I just want to point out that these are critical forms that are required for the specimen tracking. So we'll focus in on this all specimens folder. And here we see that the SNOMED disease term and code got derived in from that histology and disease form. There's another smaller list of diseases. It's about, I think, under 100, but it is a list that the biorepository nationwide, Children's Hospital, they like to use this. So we're including this field as well, and it should, of course, match up with the SNOMED disease in some way. If I start typing lymphoma, it quickly reduces the list down. I'm going to choose this miscellaneous option. And right here we see prior to uploading any pathology report for a specimen, please ensure all personal information for patient is redacted. Again, we have the option in this specimen tracking enrollment form to upload reports. There's also instructions on the screen. For the first specimen, please edit the first log line below to enter the data. For subsequent specimens, just add a new log line. So we start out with one log line. If we can either click on the edit pencil or on any of the fields here, and yes, we want to continue. So it was noticing that I had done some data entry and then was getting into this log line data entry. Wanted to make sure I wanted to continue. Yes, I do. So here we've got a protocol time point, and that's defined in the protocol that there's specimens collected at baseline, and then course 1, day 1, when the patient is in fact on treatment, and then every 3 courses thereafter on day 1, and then there's also a possibility for the crossover. The patient might be in Arm A or in Arm B at the initial determination of eligibility based on the randomization data, but there's also a time in the treatment of the patient where they may need to cross over from Arm A to Arm B, and there's a specimen that should be collected during at that moment as well. So I'm going to choose baseline here.
Oh, yeah. It's on.
Is there a question? Okay, we'll just continue. If there are any questions as we go along, please do ask. Specimen category. So here there's a wide range of specimen categories. The tracking system is designed to be generic so that it can be utilized for any protocol. So this is not to say that 10191 would be collecting every one of these types of specimens. I'm just going to choose a blood specimen here. It could also be that we're doing a tissue analysis. Maybe we should choose that one instead. We'll go with a formalin-fixed paraffin-embedded tissue specimen. When we've chosen the category, the specimen type drop-down changes. So based on the selection of the formalin-fixed paraffin-embedded tissue, we've got appropriate specimen types, FFPE block, cell block, FFPE scroll, etc. It is a search list, so again, you can just start typing whatever it is that you need to choose from this list. On the second page of that search list, we've got DNA and RNA as well, but you wouldn't need to actually scroll through this list. You can simply start typing. And just to illustrate, if I choose blood instead of the formalin-fixed option, then my drop-down is a very different list. So the specimen type list is dynamic. It's a dynamic search list. So I just started typing FF, and it gave me the 3 options that begin with that. We have a block number, which is only utilized for tissue specimens and sometimes only for archival ones. I'll just add a bit of data here. It's usually a short numeric number. The type of tissue that is submitted, we'll choose this metastatic. And perhaps there was a surgery, so we might have in order to get the specimen, there could be a surgical pathology ID. Next, we have the number of labels that are needed. Now, a specimen could be collected and then stored in a number of containers. A blood sample is one typical example where you might have several test tubes, and we need to make sure that there's a label for every container. So it does not matter from the program's point of view whether you put a 1, 2, 10, or 50 in here. You're going to want to put the number of labels that you need for the specimen you're collecting. I would recommend always doing one more than you need, at least one more, because then you can use the extra label to identify the report that you're going to upload into the histology and disease form and perhaps into this specimen tracking enrollment form. So I'm going to put in 3 labels here. One is for the actual specimen. Another one is for the pathology report we'll upload into the histology and disease form, and another one for a relevant report that is connected directly to the specimen. So the histology and disease form has general pathology, molecular surgery reports. If you have something that's connected directly to the specimen, it's to be uploaded in this form. So right now, I'm not going to upload anything. I don't have any labels yet. I'm just going to click on Save. And now we've got one specimen that has been enrolled. There's a specimen folder now for that one specimen. The number, specimen 1, corresponds with the log line here in this enrollment form. Let me just add another specimen quickly just to illustrate again. And maybe this time it will be a blood specimen. Perhaps a plasma process. And we'll just say that we need 4 labels for 4 different test tubes. Or perhaps there's a special report connected to that blood sample. Maybe one of these labels is going to go for that report, and there's only going to be 3 test tubes. I'll click Save. Now I've got 2 specimen folders up here on the left. Again, the number of the folder corresponds to the log line and to the number of the specimen. We don't even need to go into any further detail. It's now time to print labels and collect the specimens. We don't know exactly what time they'll be collected, if time is important in recording it. So we'll go right into printing the labels out, and we'll come back to do more data entry after the specimen's been collected. So to get back to the place where I can print a report, I have to go to the subject level, clicking right on this tab in the RAVE environment, and there's my specimen labels report. When I click on that report, it opens up some filters, and it's telling me the study I'm in, the site group, the site where the patient is, and the subject ID. Now I've got 2 different ways that I can specify the labels. So there's a time point drop down. Right now we've only entered baseline data, but there's also collection dates. And we haven't entered any date yet for this patient. So we wouldn't want to use this, but later on we could print the labels with the date that was entered in the specimen transmittal form. For now, we'll just click on this baseline checkbox and submit the report. And this report screen here is redrawing right now. In the current plan, we are developing a barcode for these labels. It's not currently implemented yet. So the label that you see here does not have a barcode on it. Eventually, there will be some kind of a barcode in the same area where we've currently got label information for the different fields. So that will be coming along hopefully in the next few months. The barcode will be the specimen ID so that we can easily scan that code in order to get that specimen ID into other systems. This label is a 1-inch high label and 2.625 inch wide. It's a standard size Avery mailing label. Might be a little bit big for certain containers, and we'll be doing our best to try to shrink it down. But right now, in order to get the data on the label that the biorepository needs, we had to go with this size, and it was the size that the Nationwide Children's Hospital recommended. So on this label, we do have the patient ID concatenated to the protocol number itself. So this first field is showing one identifier, patient 48. And then there's also the universal patient ID. So there's just a space in between. This line is called the patient IDs. We've got 2 of them here. Lots of information on this one line. Down, the second line contains the specimen ID. It's generated by the system. And every specimen that's shipped to the biorepository needs to have the RAVE-generated specimen ID on it. So that's why this label is important. We also have the time point, the specimen type, the FFPE block, and then there's a code list here. M stands for metastatic. That was the tissue type. We have the block ID and the surgical pathology ID. So these 3 are joined together in one line of codes. If it was a blood sample, it wouldn't have that code list here. And the date and time are empty. The expectation is that for almost all cases, you'll be printing labels in this format and then handwriting. The lab will handwrite the date and, if need be, the time on the specimen label directly once the specimen has been collected. So the data entry might be done outside of the lab. Somebody who's got that CRA specimen tracking role will do the initial data entry, print out the labels, and send those labels to the lab. Or perhaps the lab personnel themselves will do that. It just depends on what arrangements are made at each site. The labels are designed for a label printer. A label printer has 1 label per page, so to speak. So we just have this 1 label here in the upper left corner. And at the bottom of this screen, it says page 1 of 1+. If we click the go to the last page icon, it will tell us how many labels are going to actually print, and there's seven of them here. Remember that we had entered, I believe, 3 labels for the tissue specimen and 4 for the blood sample. And so here we're looking at the 7th label now. Again, we see the specimen ID, the same universal patient ID and the treatment patient ID. A different specimen ID, the baseline time point, and the category of plasma. There's no codes here because we didn't enter that data in the tracking enrollment form. And we can zip back through the different labels. There'll be 4 that are the same, and then we get back to labels 1, 2, and 3 for the tissues. So these labels need to be printed. So we're going to use the printer icon here. If I can, there we go. And so this printer interface is to generate a PDF file as opposed to actually a document that's going direct to the printer. So we might, it doesn't really matter with the labels which size we use, but I'm just going to print this. It's going to generate a PDF. And here, if I click on the PDF, it opens up in the Adobe plugin for this browser. So this can then be sent directly to the printer. So once we have those labels printed, we're going to go back to the reports that still need to be uploaded. So here in my Adobe interface, I've got the sample path report without the label. Oh, that is with the label, sorry. Here's the original report, and before this report is actually loaded into RAVE, we want to redact the personal information. And so in this instance of the report, that label that was just printed, sorry, not exactly the one that we just printed, but one I had worked with earlier, is applied over that personal information. So it's, I just stuck the label right on the report and then scanned it. So this way we get the specimen ID, we have the patient IDs, and we're covering over the patient name and the medical records number. Back in the RAVE environment now, if we go back to that enrollment form, I'm sorry, the histology and disease form within the enrollment folder, I can upload a pathology report. I'm just going to click the edit pencil, click on choose file, and it's going to take me into my computer, and I can navigate through different folders to find the report that I need. So right now it's showing that I'm in protocols 10,057. Well, that's not the protocol I'm working on. I'm going to click on protocols and scroll down looking for 10,191. Here we are. And here we've got the sample path report with the label. That's the one that we want. I'll click open, and it's now listed here right on the form. I just saved the form, and it's now uploading that report into the RAVE database. And so now anybody, say at the biorepository far away, could log into RAVE and download this pathology report whenever they need to. Back in the All Specimens folder, in the specimen tracking enrollment form, we could also decide to upload a report. Right, so I'm just going to click the edit pencil, and I want to pick the line item for upload relevant report for specimen. Click the edit pencil there, choose the file, and here I would choose a different report, not the one that I just uploaded, but I don't happen to have an extra one created other than the one that's got the personal information of the patient on it. I'll just utilize this same sample. save the form. So we're now ready for those labels to go to the laboratory, or at least to be printed out at the laboratory, and the specimens are collected. The labels are applied to the specimen containers, and the date and possibly the time is written on those labels. Coming back into data entry, we're going to go into the specimen transmittal form. So here we have that data that was derived in from some other forms, the universal patient ID, the specimen ID, the primary site of disease, diagnosis disease group, protocol time point, the specimen category, and the specimen type. So now we can enter the date, and let's suppose that this was collected today. So we'll put in the 18th of October, 2018, and maybe it's at 10 o'clock this morning. And some fields are only relevant for certain types of specimens. The collection tube type would not be relevant for the FFPE block, and the slide prep type might or might not, but I don't believe so in terms of a block. But we're going to enter the number of samples collected, and it was just one sample. We printed extra labels, but we only actually collected one FFPE block. Number of aliquots doesn't apply in this case. So we have the original number of specimens available for submission, and I'll enter 1 there. Next, we have some additional fields, a relevant process that was done to the specimen. There was a fixation done, and so we'll choose fixate. And the sample process date would be the time when was the fixation done. We want to record that here. I'll put in today's date. And the sample process time would be when was the specimen put into the fixation solution. Suppose it was at 1 this afternoon. Site from which the specimen was taken. Again, this is a search field. If I begin typing, I get bladder. I'm just going to choose that one and click on Save. So this form represents the details that the biorepository and other labs will need to know about the specimen when it gets shipped to them. Shipping status comes next. We are ready to ship this specimen. We go to the shipping status form, and we're going to edit this line. We need to specify the courier, FedEx, UPS, USPS, or even it might be a local or hand-carried specimen going from one part of an institution to another. I'll choose FedEx in this case and enter some tracking information. The source, again, has a long list of different ETCTN sites. It's a search list, so I can just begin typing my own institution. I type D, and it goes right to Dana-Farber. I just press Enter, tab down to the contact name. Here we need to enter the name of the person who's responsible for the specimen and who can be contacted. That person should be somebody who has a RAVE account. It might not be the person doing the data entry, but whoever's name is entered here should be somebody who has access to RAVE, because they have to be able to answer to the data that's been entered. So I'm putting in their CTEP-IM name, and I'm just going to use my name in this case, and my phone number. And the destination, this is specified by the protocol where specimens might be sent. So we've got the biorepository, the MOCA lab, the Broad Institute, and a lab right at Dana-Farber. So I'm going to choose the biorepository, and then I have a drop-down of somebody at the biorepository who would receive it. The next field is going to be derived when I save this form. Shipping conditions, a specimen at room temperature, and the date shipped. Let's suppose it was shipped later this afternoon. Samples sent. I'm skipping over this checkbox for now. I'm just going to put 1 here. It's important to say exactly how many specimens you're including. When you're ready for the specimen to actually ship out, you're going to click this checkbox to send an email alert. But I want to show you a few other things first. So I'm going to click on Save. And I now have this specimen ready to go. Now, it's possible to include several specimens in one shipment. So I'm just going to go back and do some quick data entry. Go back to all specimens and follow up with specimen number 2. So we'll say that the blood sample was taken the same day, maybe a little later. And let's suppose we had 3 blood test tubes collected, but then there was, in the aliquot process of generating the plasma, we had some different number. Maybe there was 4 containers in the result. So the original number of specimens available for submission will be 4 in this case. And perhaps the plasma was frozen, and we're going to clearly indicate when that happened and the time that it happened. And then I'm going to specify that this was a blood sample and save the form. So this sample is going to go in the same box. Some boxes can have frozen samples and room temperature samples in them. The biorepository can provide those types of shipping containers. And in the shipping status form, I could re-enter everything, but we have a copy shipping form. And that facilitates getting the correct shipping information into several different specimen shipping status forms. In order to use this form, we simply click on the checkbox at the top. Sometimes you have to edit using the edit pencil in order to be able to click the checkbox, but you can come back to this form many times and always refresh it. There's instructions right on the form, but when I click Save, it is going to search through the UAT environment and come up with all of the different possible tracking numbers. So here's different test cases that were done and different dates that the shipment was set for. This form can be organized simply by clicking on the tracking number if you want to organize it by tracking number, or you can click on it by ship date. It reorganizes it by ship date. It could be possible that you'll have more than one page on this form, so you might have to work with pagination to find the particular tracking record that you need. All of the different shipments for all of the specimens, not just this patient, but multiple patients, will be listed in this form. You can even have specimens from several patients all in the same box, as long as you include the right documentation. So we want to use this one from October 18, and I need to click the checkbox, but it's not available. So I've got to click the edit pencil, click the checkbox there and click on Save. Now when I go to the shipping status form, all that data that I had previously entered is entered in here. I do need to edit this because sample sent is going to be different for a different sample. So if I put in, I think we had 4 of those plasmas, I can click Save. Now, we're ready to print out the shipping list. So I would go back to my patient. I see that there's only labels available here. If I go back to the site, my site, I see that I can print the shipping list, right? The shipping list is at the site level because multiple patients could be in the box, so to speak. I'll click on this report. I've got to now specify the tracking number. All right, so here is my tracking number that I just entered. It's good for 2 different specimens. I click Submit Report, and again, it's going to redraw the screen in a moment. At the bottom of the screen, it says waiting, and now it's generating. It's important in the box with the specimens that you include this shipping list and also copies of any reports that you've uploaded, pathology report, molecular report, surgery, radiology. So the biorepository is expecting to receive hard copies of those reports. And here is the shipping list. It has the 2 different specimens. Again, we've got the same patient here, but the report's designed to include the protocol patient ID, the universal patient ID, the specimen IDs from possibly multiple patients. I would print this out, again, in the same way. And in this case, I'm going to choose letter instead of A4. And also, I could specify a landscape orientation since it's kind of going across the page. Click on Print. It has generated a PDF. Again, if I click on that, it comes up on the screen. There's a little bit of overflow onto a second page. All the data is here, however. And then this can be sent directly to the printer. So then I'm now ready to ship that specimen. I'm going to go back in and send the email alert. So I need to go back to my patient 48, and into the all specimens and into it, just one of the specimen transmittal. So I go into shipping status and edit the line and click on the checkbox. I've got to edit that field. And so now when I click Save, there's going to be an email that goes to the biorepository. It's going to go to this address. I don't want to surprise them by them thinking, oh, there's a specimen coming today, so I'm not going to click Save here because it will send an email. What I can show you, though, we have just a few minutes, but in the All Specimens folder, we have a tracking contacts form. Here's all of the different destinations that the specimen might be going to. There are the 4 labs, well, the biorepository and 3 labs, and then it also includes me. So the specimen might need to be returned back to the treating site if the patient withdraws consent. So as soon as a specimen is set up for shipment, whoever is doing the shipment from the site is also entered in tracking contacts. The email address comes from the RAVE user account. Now, if I'm sending this to the biorepository and I discover that the email address is wrong, I can change it. So I'm going to put in my email address here. And we should have just barely enough time to do this. And so going back now to that first specimen, shipping status, I have to edit this log line in order to get that email to change. So I'm going to choose, that's not the one I wanted. Here we go. So our destination, I'm just going to take it away for a moment, and that's going to reset the email address. Now I've got to go back in here and, oops, let's take this away as well. Normally you won't have to do this, but just for the demonstration here. So now it's got P. Clark listed. And so I will now have the email sent to me. So the email gets sent. You're going to print the reports, put them in the box with the specimen, and ship it out. When you will get information back from the site that they did receive it. And so here I've gotten an email that's just come in. Hi, biorepository staff. The following specimens are being shipped overnight to you via FedEx. The tracking number is included, treatment patient ID, universal patient ID, and the specimen IDs that are in the box. So this is generated by RAVE and sent automatically. And now, basically, this particular patient, which was the step 1 registration, we've gone through the process of submitting the specimens for analysis. You're going to follow the same process when the patient is eligible and live in the study. So the process remains the same. This particular patient, we were just doing this to determine the eligibility. So any quick questions before we finish this training?
I just wanted to ask a few just overview questions just to make sure that you know that this is all set up in the right way. So there is no eligibility criteria that depends on the review of the biospecimens. So I just wanted to make sure that that was sort of clear. That as long as there are specimens sent, the patient is eligible, and there's no kind of second check to confirm their eligibility.
Very good.
Okay, and then the second piece is that, yeah. Go ahead.
But isn't there some specimen that does need to be collected right before the patient joins the study?
Yes, exactly. So I just wanted to make sure that that was configured correctly, that that the eligibility is based on the obtaining a specimen rather than any review of the specimen.
Excellent.
This is Diana. The question in the eligibility question in step 1 is whether or not the patient is willing to undergo the biopsy. And that was on the configuration document that was signed off, I don't even know the date on that. And because there's the additional qualifier regarding that confirmation that the biopsy was adequate is not required, not applicable is also a valid answer to the question.
Okay, great.
Okay, so that is set up that way. The reason it's a two-step is because the specimen tracking module in RAVE has to be used. The only way to get the patient into RAVE before eligibility is even determined is if we use the two-step process, because otherwise, unless a patient is registered, they don't go into RAVE.
That's what I figured. I just wanted to confirm.
Yep. That's the way we set it up.
Great. And then the second piece I just wanted to confirm is that, obviously the pathology reports aren't going to be available at the time that the specimens are sent. So as long as, the record remains open so that that can be added later when it becomes available, I just want to make sure that that shipping the specimens doesn't somehow close the record so that people can come in a week later and then upload the pathology report when it's available.
Absolutely, yeah. So
okay, great.
You can always go back in to the histology and disease form and simply edit the field, and you can, suppose you accidentally loaded the wrong pathology report in, you can remove this and choose a new one. But yes, so the record's always available to send the pathology report either here or in the specimen tracking enrollment form.
Great. I think those were the only couple high-level things that I wanted to be positive about, but then I'm sure the rest of our team has more kind of detailed questions. So
I'm happy to entertain more questions now from anybody else on the team.
Anna, anything from your end?
No, not right now.
Okay, great.
I think we just have to work our way through this first.
Yes.
Sure, yeah, exactly.
And I will also send this presentation over to you, and it includes the different steps that I went through, so it can be used as a reference for the different phases of the specimen tracking. So, and this recording will be available probably eventually on the Theradex website. We have a page here for NCI studies, and we'll have some more specimen tracking training links listed eventually. But until we get this page updated, if you need somebody to have the training, you can just email me, and I'll send them a link.
Hi, this is Sarah. I just have a really quick question.
Yeah.
So about the FedEx tracking information, sorry if I missed this, but is that coming from the site using like their own FedEx systems, or are those like sent out in the kits?
That's a very good question, and I'm not 100% sure about it. I know that sometimes the biorepository does include that FedEx information right with a kit, but I don't know for sure if that has been organized for your protocol. So
okay,
something we should follow up with the biorepository on. It would certainly be easier for you if even the tracking number was already sent to you, that you could then enter in here.
Yeah, I know sometimes, like for industry sponsors, they'll include it, some don't, but I think most teams have their own FedEx accounts at this point and probably could input it, but if it comes in the kit, that's great too. So I guess we'll just see how they end up getting shipped out.
Yeah, yeah.
So sorry, this is Atish. I actually have to get going to another meeting, so I'm going to get off the call. But if there's any other questions that come up, I'm happy to catch up on those later.
Thank you for your attendance, Doctor.
Okay, thank you so much. Bye-bye.
You're welcome. And just to say one last thing here, this shipping status form is a log form. So when the specimen gets shipped from the biorepository to some other lab, like the MOCA lab for further analysis, then they would be adding another log line here to indicate the next shipment of the specimen. So, but we won't go into that right now because we've gone past our hour. So thank you, everybody, for your attention, and I will send the CRA specimen tracking role to anybody on this call from the site who needs to have that role. So please send me an email to confirm that you will actually be doing data entry. I know some people on the call are just listening in to understand the system, and so just send me an email. I'll also reach out to each person to see if they need to have an actual CRA specimen tracking role, and a certificate will be provided to indicate that you've gone through the training. So thank you very much, everybody.
Thank you.
Thank you.
Bye-bye.
Bye. Thank you.